short but to the point, and we'll leave plenty of time for you folks to ask all the questions that you might have, in addition to providing you with all the resources that are available both through the Extended Health and Dental Plan as well as through the GSA with respect to all of your health needs for the year. So without further ado, if it's all right with the team, I'm gonna just start doing the screen share and we'll go through the presentation. So we're good to get started, or do we want to wait a couple more minutes for folks? We're good? Okay, beautiful. So just gonna do a quick little screen share here. And beautiful. So can everybody see the screen? Are we okay? Fantastic. Okay, thank you so much. So thank you folks for being here today. We're gonna have a quick chat about what is the Extended Health and Dental Plan? Why do you have an Extended Health and Dental Plan, and how you can use an Extended Health and Dental Plan? So right off the bat, your Extended Health and Dental Plan covers you for everything that is not covered by provincial health care. So in Alberta, you will qualify for Alberta Health, whether you're a domestic student or an international student, you will have access to provincial care. And provincial care will cover you for everything from doctor's visits and hospitalizations. However, there's a lot of areas that are missing from provincial care, and that's where the GSA Extended Health and Dental Plan kicks in. So the GSA Extended Health and Dental Plan is essentially there to cover you for everything that is not provided by the Alberta healthcare system or any other provincial healthcare system that you might be using as you are studying at the University of Calgary. So the Student Health and Dental Plan will cover you for areas such as healthcare, including prescription drugs, vaccinations, health practitioners and medical equipment, dental coverage, vision care, and lastly, travel coverage. So I will note that this is a very unprecedented year in that most folks won't be traveling necessarily for the foreseeable future. However, services are available through your Extended Health and Dental Plan for travel coverage. So if you are planning to travel, please do visit our website at www.studentcare.ca to learn about what restrictions are currently applied to the travel coverage, as well as the travel advisories that are provided to through the federal government of Canada. One quick note that I'll also make about the travel coverage is that if you're an international student returning to your home country and maintaining the Extended Health and Dental Plan for this academic year, the travel coverage under normal circumstances would not cover you in your home country if you're traveling with a passport from said country. The expectation from the insurer being that you have universal care equivalent to what we have here in Canada to cover you while you're going home. So again, additional information about what's covered on the Extended Health and Dental Plan will be available on our website, as well as through the physical brochures and digital brochures of plan coverage that will be available both through the GSA as well as digitally. So all that information will be shared with you after the fact. So why do we have a group health and dental plan? Just right off the bat, this plan was introduced by the GSA through referendum and has been on campus for well over 8 years now. So the intention behind a group plan is to provide you with more affordable and accessible healthcare coverage to supplement what's not covered by the provincial government. So right off the bat, your group health and dental plan, similar to an employer plan that would be made available to you if you were in industry, is 5 to 7 times cheaper than what it would cost for you to go out and purchase the same plan with the same level of coverage on your own. More frequently than not, when you go out and purchase private coverage, there is a lot of discriminatory factors for folks who are a bit older or who might have pre-existing conditions, and more specifically for women compared to their male counterparts, as they're deemed to be higher users and quote unquote more high risk categories of individuals. So the group plan really is an equalizer and is meant to support and supplement students during a time where finances can be tight, and is there to really support you folks. In addition to that, beyond just the basic coverage that's provided through the Extended Health and Dental Plan, you folks actually have access to an exclusive network through STUDENTCARE. And what that means is that you folks can actually get a lot of savings through the practitioners that we work with. You're not mandated or obligated to use the practitioners that are on this list. I know there are some plans that require that. This is not one of those plans. So you folks can actually use your benefits anywhere in Canada with any practitioner that's obviously licensed and falls under the category of what's covered through the Extended Health and Dental Plan. However, if you choose to use one of our practitioners, and the limit does not, it includes everything from vision, massage, physio, chiro, prescription drugs, as well as dental, you save a little bit of money. As an example, this is just the dental network savings and what it means in Alberta to have access to the dental network coverage. So dental care in the province of Alberta is really, really expensive. So right off the bat, if you visit one of our dentists, you automatically save 30% on the overall cost of your expenses for that visit. So for preventative services where you have 70% coverage, if you go to one of our dentists, you save 30% for a total of 100% coverage. Again, you're not mandated to go to our dental practitioners in the province of Alberta or any other practitioner that we work with in Canada. However, there are fairly substantial savings. And I'll also note that our dentists in the province of Alberta and everywhere else in Canada actually have to adhere to a fee guide, which isn't mandatory in the province of Alberta. There is a recommended fee guide. However, there tends to be quite a bit of discrepancy as to what dental practices will charge. And so our practitioners are not overcharging you and then like marking down by 30%. It's actually very fairly priced, which is an additional saving to students. So it saves you a little bit of money, it saves the client a little bit of money, and all around is beneficial. One additional thing that I'll note is that we actually have an exclusive partnership with Rexall. So regardless of whether you know about the discount and you request the discount, it's hardwired into their systems. When you use a student care plan at Rexall, you'll save up to approximately 10% up to $40 per prescription refill, which is kind of nice as well. So you don't need to ask for it. If you just get direct bill, that'll be covered at Rexall for you. Another thing that I'll add, just one sec, is that this past year, the Calgary GSA implemented a new mental health service. It's a really, really exciting service, similar to an EAP, so an employee assistance plan. The student assistance plan, Empower Me, is available to you 24/7, 365 days a year to help you address any questions pertaining to your mental health and to actually pair you off with a mental health practitioner or any sort of wellness practitioner that you might need without actually having to pay out of pocket, which is quite fantastic. So the types of issues and areas that you can get support in are listed here for you. You're not limited to this list by any means. There's a number of different supports that are available, like nutritional counseling, financial counseling, all of which are facilitated by professionals that are not designated to sell you products. They're actually just there to give you advice and to give you a professional opinion, as well as mental health support such as counseling, psychology support, a master's of social wealth. And so how the system works is that you call the dedicated 1-800 number, there's an intake process that takes place, and then you're paired off with a practitioner within 48 hours. So this little chart here just gives us a breakdown of what it looks like to use the service. So you call the 1-800 number. If you're in crisis, there's immediate crisis support. If you'd like to leave a message and be contacted later after the fact, you can press 8, or you can stay on the line and a practitioner will collect your information and then channel you to the mental health practitioner or health and well-being practitioner that best suits your needs. The only caveat with this service is that it's meant to be short-term solutions-based counseling. So for folks who need long-term care, there are additional supports that are actually available through the extended health and dental plan. So monies that can be dedicated towards additional mental health services and supports. However, this is an unlimited support. You can contact it as many times as you'd like throughout the year. It's faith inclusive, multiculturally sensitive, LGBTQ plus inclusive, and where possible, they will try and pair you with a practitioner that both best suits your needs. And if there's any linguistic difficulties, they'll try and pair you with a practitioner that can assist you in the language of your choice. It is a multimodality service, so you don't necessarily need to do telephonic counseling or video counseling. Under normal circumstances, the service would be available to you in person, so they would find a practitioner that's close to where you're based off of, so you can have in-person counseling as well. However, with everything that's going on right now, obviously, more and more practitioners are doing virtual care, and so that is right now the more prevalent option that's available. However, as the situation unfolds and based on a case-by-case basis, in-person care can be made available as well. For those of you who are joining us today from abroad, we've actually expanded the service offering from what was available last year. This is just a list of countries that we have dedicated lines for, so you can actually access the service abroad. In instances where your country is not listed here and you do need access to care, please let the GSA know and they'll be in touch with us, and we'll try and facilitate based off of the resources that we have available to us to find a practitioner that kind of fits the bill and follows the criterion that we need to be able to facilitate access to care. However, we're really excited to announce that we are working with about 23 countries. This list will be expanding, obviously, as time progresses to provide care for students who are based abroad. Lastly, I'll note that Empower Me is a fully confidential service. So again, this is not tied back to the university in any capacity. So your confidentiality will be strictly adhered to. The only instance where your information will be shared is if you consent to have your information shared for whatever reason or intention is determined by the healthcare professional that you're working with. The only instance where confidentiality would be breached is if you were at risk to yourself or at risk to harming others. But other than that, it follows all the provincial criterion required by health practitioners for confidentiality. Beyond that, there's some important information about the health and dental plan with respect to deadlines. So if you plan on enrolling a dependent or opting out of the extended health and dental plan, you can do so from August 26th to September 25th. 2020. There's an intake period for every semester. So if you are actually a student who will be starting their studies in January, your intake period will be in January. But I would imagine that most of you who are joining us today are September intake students. So your change of coverage period is August 26th to September 25th. If you have any questions, concerns about what your intake period is, how to opt out, all of that fun stuff, you can always contact us. Our contact information will be listed at the end. I will make a point to say that this year, provided everything that's happening kind of globally with all the travel restrictions that exist, and recognizing that a lot of international students will be studying and remaining abroad for the duration of the academic year, we're actually allowing international students to opt out of the extended health and dental plan as well. So if you are a September or January intake student, international intake student who is living abroad, you can either opt out of the plan during this dedicated change of coverage period or postpone your change of coverage period to July. So this is only for international students. There will be a dedicated change of coverage period in July 2021 for students who are unsure. So if you might be coming back to Canada and you think you might be, if you think you might be coming back to Canada and will therefore need access to extended services, we recommend that you obviously postpone. However, the option is available to you if you know that you won't be coming back to Canada to opt out of the extended health and dental plan during the fall change of coverage period. And additional information on the requirements of international students and how they can opt out can be found on our website shortly. So how to opt out. Essentially, you can opt out of the extended health and dental plan if you have proof of alternative coverage for regular students who are residing in Canada. And what that means is essentially a letter from an employer, a pay direct card from an additional extended health and dental plan, a letter from the employer of a partner or a spouse, to essentially indicate that you have coverage elsewhere. If you have coverage through band coverage, if you're an Indigenous student who has band coverage, that's also an acceptable form of alternative coverage because there is federally funded supports for Indigenous students. So you'd visit our website at www.studentencare.ca and you'll be receiving a series of emails from us as well that link you to the change of coverage management tool where you can go in and you can alternate your coverage, remove yourself from the health and dental plan, or compare coverage to what you have through another alternative provider, and see if it makes sense to combine coverage. As previously mentioned, the best resource to contacting us would be to call our dedicated 1-800 number. This number is fantastic because we will be able to pull up your specific details and support you kind of on a one-on-one basis and refer you to the appropriate places to kind of conduct the business that you're trying to conduct. So we're available Monday to Friday, 9 to 5. There's also a chat function available through our website, as well as a secure message link where you can type out a message and one of our team members will be in touch with you via email. With all that being said, I highly, highly recommend that you folks visit our website at www.studentencare.ca. The vast majority of information regarding all of the coverage areas of the health and dental plan, as well as supports that are available through the health and dental plan, information about Empower Me, the travel coverage, all can be found on the Student Care website. You just go onto the home page, select Calgary GSA on the drop-down menu, and then you'll be taken to the GSA specific website with all of the plan coverage details there. So with all that being said, I'm going to open the floor up to questions. I know we received a series of questions in advance, which I'm happy to go through. And I know that the chat function will also be open and you folks can ask your questions for the next little bit. So I'm going to end.
Thank you. Thank you so much, Bahare, for all the wonderful information that you provided. I'm sure all the students appreciate it and it's very useful. So yeah, we received a bunch of questions, a lot of them, some of them were general, some of them were very specific to COVID related, international student specific, and some were specific to dental care and also vision care. So if you'd like, we could probably start with the general questions. So yeah, one of the first questions we received was that students continuing their studies from other provinces are wondering if they can access their health and dental benefits from another province, or if they require a health card from the province that they are currently residing in. So whether the Alberta healthcare is sufficient, or should they have the province-specific healthcare?
Great question. So if you're residing in another province, you absolutely have coverage to the extended health and dental plan. It's available nationally to you folks. One of the minimum requirements is that you do have primary care, which is provincial health care, whether it's Alberta Health, BC MSP, Ontario Health, Quebec Health, whatever it is. It's required that you have some form of primary care. If you're an international student residing in another province, you will have gone through the steps of procuring provincial health care, and in the intern can have an alternative form of insurance. However, the GSA extended health and dental plan is available, is applicable and is usable both in Alberta or any other province or territory across Canada.
Great, thank you so much. There was another question that says, is there a way to get a card for our health and dental insurance?
Great question. So all of that information can be found on our website at www.studentkare.ca. I actually have my colleague, Robin, who's also joining us today, and he's answering a number of questions. So Robin, if you wouldn't mind just actually linking the Pay Direct card in the chat function so folks can just download it directly from the chat function, but it is available on our website, and physical copies are available in the GSA website. If you happen to be on campus and wanted to grab one, I'm sure they'll be allocated across campus as well, especially at the GSA offices.
Thank you. I saw a couple of questions related to that. So just to confirm, so either the app or the card, one of them could also be okay, right? If the app is not working for you?
Absolutely. That's a great observation. The mobile app, which is used primarily for claiming, can also serve as your Pay Direct card. So there's a digital copy of the Pay Direct card that's available through the Student Care app. I would highly encourage you folks to download the Student Care app if you haven't already. It just makes claiming substantially easier. You just take a picture of your receipt and input some information, and it goes directly to the insurance company, and then a copy of your Pay Direct card is available there as well. You don't actually need the physical card when you visit a health practitioner. All they really need is the policy information, which is the policy number and your student ID. So those are the two pieces of information. So even just having a picture of it on your phone or just a saved copy of it on your phone will be sufficient. So you don't actually need a physical copy, but physical copies are also available online. And that's a great point about the app as well.
Thank you so much. So the other question was that, so some of the students are wondering that they recently opted out of their health and dental plan, and like, would they have to opt out of their health and dental plan annually or per semester, or is it just a one-time thing?
Great question. So it's an annual opt-out process. Once you opt out during your dedicated change of coverage period, depending on what your intake period is, you'll be opted out for the full 12 months, and then you'll be re-enrolled the following year. So it's an annual process.
Thank you. I think we got a bunch of...
If I may, Bahara, would you mind going through some the details of the international student opt-out in more detail? We're getting a lot of questions about that special opt-out period, and especially the July 2021 option.
Absolutely. So let me just pull up the details really quickly. So folks, for international students residing abroad, as previously mentioned, you have two opportunities to opt out of the extended health and dental plan if you are a September or January intake student. So what that means is if you're starting your studies in September, you can opt out during the designated period that started in August and ends in mid-September, or you can postpone your opt-out to the week of July 5th to July 19th of 2021. And essentially what that means is that this is a period in time where we're allowing students who might not have returned for the academic year of 2020-2021 to remove themselves and get a retroactive refund for the plan that will be credited to your student account. So with that being said, there are three pieces of information that you can provide as an international student residing abroad for us to accept the opt-out. And that includes a letter from the institution indicating that you're an international student, an enrollment letter, whatever that may look like, your study permit, or an approval letter while you wait for your study permit, recognizing that there are delays for some students in receiving their study permits this year from the federal government. So again, the intention here is to support international students who do not come back to Canada and will therefore not have access to the services that are provided to the Extended Health and Dental Plan. More information will be shared on our website shortly regarding this policy. And again, we encourage you to contact us if you have any questions, but both the September change of coverage period as well as the July change of coverage period will be made available, again, specifically to international students residing outside of Canada.
Thank you so much, Bahari. We have been getting tons of questions just specific to that, and I think a lot of those questions have just been answered. So the question would be, how do I opt out from dental insurance? So they just want to keep health insurance, so is it possible to do that?
Great question. Yes, on the change of coverage tool, it'll actually show you the prompts of opting out of health and then opting out of dental, and you can kind of pick and choose as you go through that opt functionality, and all of that is available through the change of the change of coverage tool. So I encourage you all to kind of go through that prompt. You should have received an email from StudentCare that would have linked you to the change of coverage tool. There's going to be another reminder email that comes up, and that information is readily available on our website as well.
Great, thank you. So the next question is that someone said, I recently opted out of my health and dental benefits starting on September 1st, and I also paid my UCalgary tuition. However, do you know what's the process in for receiving a refund, and who should I contact for this?
That's a great question. So your refund will actually be in the form of a credit for next semester's tuition. So you'll receive it in the form of a credit, and it'll be stated on your tuition statement for the following semester.
Great, thank you so much. So next question would be, I'm wondering if there are any changes on the 2020 dental coverage for students who started their program on January 2019, as I think it has increased in 2020.
Apologies, sorry, I muted myself. All of the coverage information, depending on your intake period, are posted on our website. So please, I recognize that you're absolutely right. It does adjust depending on when the decisions for the policy come into effect. So I'd encourage you to visit our website at www.studentcare.ca, and all of the specific details for your intake period will be posted there. But that is correct. There are adjustments that are made, and those adjustments come into effect depending on when the decision is finalized by the GSA.
Great, thanks a lot. So the other question is, what would be the procedure to claim insurance?
Great question. So the most commonly used forms of the Extended Health and Dental Plan are the prescription drugs and the dental coverage. The majority of pharmacists and dental practices will actually be able to bill the insurance company directly for the services that you receive. And so you'll only pay the copay portion of the coverage that you're seeking. However, for health practitioners such as massage, physio, chiro, vision care, in a lot of instances, because these are smaller practices, they'll actually just bill you directly, and you need to be reimbursed for those services after the fact. So there's a number of ways in which you can actually submit your claims. That information can be found on our website. My colleague Robin can actually link you guys to the claiming page on the website as well. However, as mentioned earlier, the StudentCare app is another really wonderful resource that makes it really simple and straightforward for folks to submit their claims, because you can just take a picture of your kind of paper receipt after you fill out some of the prompts, after you've set up your account essentially through the app, and it just makes it really easy to monitor what claims you've made, and then if there's ever a delay or if you're waiting to hear back and it's taken longer than what's expected, usually, I mean, Desjardins, which is the insurance company, reserves the right to take time to process each claim, but they're usually processed within 5 to 7 business days. But if it's taking longer than that, or for whatever reason you have any questions about the claim that you've submitted, you can always contact us, and our team can actually pull up very specific details about the claim in question and support you through the claiming process. I hope that answers the questions. If there's any additional details required, I'm happy to provide that as well.
Great, thanks a lot. So I think this question, the next question, is very much specific to a lot of students who actually graduate in the middle of semester. So if we pay the health and dental plan in September, but we defend in November, are we still covered until the end of term, like until August of next year?
Great question, and the answer is yes. So you have coverage for 12 months. It's kind of one of the perks of being enrolled on the extended health and dental plan. In a lot of instances, students have to wait while they transition into their employment role or whatever the case may be. So you will have coverage until the end of the academic year that you would have been in. So if you're graduating in November and say your graduation ceremony is until April, you'll actually have coverage all the way through August 31st, 2021. And then it'll obviously be adjusted for every different cohort intake. So all that information can be found on the website on the dedicated brochures for each intake.
Thank you so much. We did receive a lot of questions related to COVID, but I believe a lot of them, they have been answered with your description before, so we'll be skipping that. If you have any more very specific question related to yourself, then you could always contact Student Care at the contact that Bahare provided you in the presentation. So next one, we just have one question related to prescription drug first. That is there a maximum amount my health and dental plan will cover for prescription drug?
Great question. I'm just pulling up the policy document for you folks right off the bat, and I'll give you the exact details. Just one moment. Again, really good exercise is to go onto the microsite and just kind of play around with it. All of the details are kind of cleanly laid out for you folks. So right off the bat here. Prescription drugs are covered up to a maximum of $10,000 per student per year at 80% coverage. If your drug is not covered by the formulary, so there is a dedicated list of drugs that are available. This is very common in standard practice for extended health and dental plans. There's actually an exceptional process to get coverage for drugs that aren't covered. All that information can be found on our website as well for the drug exception process. So if you don't get automatic coverage for your prescription drug, please do refer to the website because there are steps that you can follow to actually garner and get support for those prescription medications. But the maximum annual coverage for your plan is up to $10,000 per year. And then there is a contraceptive specifically on the plan are subject to a combined maximum of $300 per student per year as well. So that's just the caveat on contraceptives, but all the information about drug coverage are found on the website as specifically under the health plan, prescription drugs, and vaccinations.
Thanks a lot, Bahari. We have a couple of questions for specific to dental care. So is the GSA plan also accepted only at dental choice offices or is it accepted at any offices?
Great question. You guys are not restricted to just visiting Dental Choice. You can go to any dental practice anywhere in Canada as long as they're licensed to operate in Canada. You're welcome to go there. However, as previously noted, on our website, we have a list of dental practitioners that we work with both inside the province of Alberta and outside in any other province should you be residing outside of Alberta that provide our students with specific discounts. In the province of Alberta, we provide 30% across the board at all of the practitioners that we work with for dental services. Outside of Alberta, it varies a little bit because Alberta dental is so expensive. We were able to strong arm them to giving our students a little bit more in terms of discounts, but typically it's anywhere between 20 to 30% for discount through the networks. However, you're not obligated to visit those practitioners. You can go to any practitioner you choose.
Thank you so much. So the next question is, do you know if all the dental services are covered by GSA Health and Dental Insurance?
So sorry, can we repeat the question?
Mm-hmm. So they're asking if all the dental services are covered by GSA Health and Dental Services. I'm assuming it means cleaning, flossing, and including all the ones that you use for aesthetics, like alignments.
Perfect. Great question. So the specific areas of coverage are noted on our website. I can actually read it out to you folks as well. So you have preventative services covered at 70%, which includes recall exams, cleanings, and scalings. You have basic services for fillings and oral extractions, oral surgery, including extractions at 60%, basic services, including endodontics and periodontics at 50%, and then major restoratives for crowns, pins, and posts covered at 50%.
Great, thank you. So the next question is a bit COVID specific. So they said, hello, I was wondering, since like the health and dental coverage have different price this year, as due to COVID, nobody is using the coverage as often. For example, dental offices are just accepting emergency cases. So the question is that since the dental offices are not open as usual, so just accepting the emergency cases, and that means that students cannot use all the services provided by health and dental insurance. So they were wondering if the prices could be a bit different this year because of COVID.
That's a great question. So unfortunately, the price of the plan is fixed and is formulated by an underwriting policy, an underwriting exercise that we go through with the insurance company. That being said, we suspect that it really varies on where you're located and whereabouts in the country you are. I recognize that Alberta is a little bit different, but we suspect that throughout this academic year, services will be opening up. We do know that in Alberta, based on, again, where you are geographically and who your health practitioner is, successions could be made to allow you to actually access care for preventative services as well. So unfortunately, just based on the underwriting experiences and protocols that we need to follow, no adjustments can be made to the cost of the plan for this particular year, but we will be monitoring the situation very closely, and we suspect that operations will be resuming normal throughout the year, and that limit can be used again for the duration of the full 12 months.
Great, thanks a lot. We have a couple of questions related to vision services. So one of them is, hi, I would like to know if the glasses coverage renews when I start a new cycle. For example, I used my health cover to cover my glasses purchase last year, and I'm turning 2 years old in my program this fall. I'm paying my health plan again. So can I use my cover? Can I use my service to cover a pair of new pair of glasses? So basically, they bought some glasses last year, and this year, because the health and dental services, it's the new plan, so start of new academic year, so they're just wondering if they can buy the glasses again.
So the answer to that question is that you receive $150 every 24 months after the full completed 24 months for the service. So if you've used them last year, then you have to wait and will be eligible depending on how long you're a student at the University of Calgary, a graduate student at the University of Calgary. But it's $150 for every 24 months, which is fairly standard for most vision coverage policies.
Okay, thank you. There's some question, and I believe we received this fairly a lot. So the question is if they wanted to buy a pair of sunglasses instead of regular glasses, because they said that for sunlight in spring and in winter, because of the beams that you get from snow, so they were wondering if they could use their health insurance plan to cover for their eyeglasses in order to buy the sunglasses instead of the eyeglasses.
Only prescription. So unfortunately, it does not cover non-prescription services, but prescription services, if you get UV lenses or SPF or like UV rays or blue light lenses, that should be covered as well, but it has to be a prescription.
So that means they would have to go to the eye care and then they would have to actually get prescription from them saying that you need these Blu-rays or say prescription sunglasses or something?
As prescription sunglasses, that's exactly right. It needs to have a specific diagnostic for vision care. It can't just be you need sunglasses, like UV protection. That unfortunately, you can't unfortunately get a pair of designer sunglasses through the extended health and dental plan. That's not covered. But if you needed prescription sunglasses or a prescription for your lenses that cover UV coverage, that would be applicable to for the coverage to be paid out.
Okay, great, thank you. One last question for the vision section. So they say I'm a new student at University of Calgary, and I was wondering that if I buy a pair of glasses without accessing my vision care package, would I be reimbursed the money later? And the amount that they put was $375. And if so, how would I be able to do this?
If you're a new student to the university, if you're a new graduate student to the University of Calgary, if you like brand new, you weren't a student last year, if you made the claim after September 1st, which is when your coverage began, then you would be able to submit a claim. However, if the claim was made prior to September 1st, because September 1st is the start of your coverage date, unfortunately, you wouldn't have had coverage at that time. The insurance company doesn't see you as having been registered in the extended health and dental plan. So any claims that are made after September 1st for this specific cohort of students will be applicable by what's covered through the extended health and dental plan. That would include $150, obviously, every 24 months. So you would then be paying the difference for the $300 and so dollar expenditure. It just really depends on when you made that purchase.
Okay, thank you so much for that. I know it's a lot of questions. We just have 3 more questions for EmpowerMe. So the first one is, does EmpowerMe mental health support cover spouses who are enrolled in the healthcare plan?
It does.
Thank you. Very short and sweet. So next one is, when I contact the EmpowerMe team, how am I connected with different professionals? And are they based in Calgary? If they're not based in Calgary, is there a way to be referred to a local professional?
Absolutely. So in instances where you're trying to set up an in-person session, you should specify, obviously, they'll get your address and they'll find someone who's close to you. Obviously, we want to minimize the commute time as well. If you're requesting to speak with someone with a very particular background or expertise for the issue that you're presenting, they might have to make accommodation, and the person might be a little bit further away. Or if the person is actually not residing in the city of Calgary, say they're a practitioner in Edmonton, but they best suit your needs, then they'll put you in touch with that practitioner, and then you can do video counseling or telephonic care. However, in instances where applicable, they will absolutely try and pair you off with someone who is geographically close to you. Yes.
Great, thank you. Just one last question that we received from our social medias. Hello, I was wondering, couldn't the health and dental coverage have different price this year? Oh, no, sorry. That's the similar to the one that we received earlier. So, okay, we are done with the questions we received from email, but Robin, if you have any questions from the chat box that you'd like to ask here, please feel free to do so.
Sure, thank you. I think I've been able to get to a large number of the questions through the chat, but we do have a couple others. Harsh is asking, what if I opted out of health and dental coverage and I land in Canada in May so I can study without any coverage till July, or do I need to at least have some form of coverage when I enter Canada?
So if this is pertaining to the international student opt-out, you can actually defer your opt-out to July. So if you'll be coming in May and recognize that you'll have services that you'll need access to, you can remain in the plan and come, and your benefits are not going to be prorated based on the fact that you're arriving later. So you'll have access to the full $700+ in dental services. You'll have access to prescription drugs, and there's a number of services that are available through the extended health and dental plan that are meant for emergencies. So should you fall sick or have an injury and need medical equipment, that can be evaluated and processed by the insurance company, which can cost a couple $1,000s. If you take like an emergency blow to the mouth and have to have like work done for emergency dental procedures, which is beyond what's covered through the dental portion of the plan, there's coverage available through the health portion of the plan for situations like that. So it really depends on the individual. We're leaving the onus to the individual to decide for themselves what's best for them. We recognize that international students have a lot of choices, and there's a lot of issues that they're facing this year because of the restrictions. So ultimately it's up to you. However, if you're opting out in September, there's no opportunity to re-enroll into the extended health and dental plan should you come back and require services. So that's one caveat that I'll note, is that once you remove yourself from the plan, you will be removed from the plan until the following policy year if you continue to be a student at the University of Calgary as a graduate student.
Thank you. We did have a question about where to find information about this procedure, and I just replied saying that information will be posted as soon as possible in regards to this. But I don't have any further. We have another one. Oh, it was an piece of information. Registering for Alberta Healthcare Insurance Plan, which is AHSS's requirement for the GSA Health and Dental Plan. Furthermore, the Alberta Healthcare Insurance Plan requires us to valid study permit to be eligible. good piece of information. I don't have any other questions in the chat at this time. If folks do have questions, please throw them in. And I will be happy, myself or my colleague Ali, who's also joined us from StudentCare, will be happy to answer them in the chat.
Great, thank you so much, Robin. So yeah, we already answered all the questions that we could. If you do have any additional questions, or maybe some of the questions are very specific to your specific situations, please feel free to call StudentCare at their 1-800 number, and also you can send any email to the GSA, any of us at the GSA, and we'll be sure to answer the questions to the best of our knowledge. Or if we cannot in any circumstances, we'll be sure to direct you to StudentCare. So please, please, please do not hesitate to do that. And as more information comes regarding the international student opt-out situation or any COVID-specific situations from StudentCare, we'll be sure to share that information with you via our newsletters as well as our social media. So please stay tuned and make sure that you keep an eye on the news and views, because we make sure to have that communication piece along for all the information that we get, specifically because this is such a weird time, such unprecedented COVID time. So you might be getting a lot of new information as we go along. And with that, I think we are good to go. Thank you so much for your attendance, and specifically thank you to StudentCare, Bahari, Robin, thank you so much for your help. And then all the students who joined here, and thank you for all your wonderful questions, for your participations, and for listening. So if there's nothing else, I would like to end the Q&A for today. Thank you so much again.
Thank you, folks. It's been a pleasure. If there's any additional questions, as mentioned, please do let us know, and you can direct them to the GSA specifically, and myself and our team will actually reach out to you personally if you have any claiming questions or whatever the case may be. But the dedicated 1-800 number, as well as the online chat function and the online messaging system available through our website, are wonderful, wonderful tools. And again, all of this information can be found on the website pertaining to the specific areas of coverage, the different levels of coverage, the restrictions that may apply depending on what area of coverage you're looking at, you know, the deductible for the dental coverage, all that's available on the website, as well as on the brochures that are available digitally on the website, as well as physically through the GSA offices.
Thank you so much. I think we're good to go. Once again, please do not hesitate to send us an email. We're here right here just for your service. So please do not hesitate, and have a great day, everyone.